Lastly, I'd like to turn it over to Mayor Tibbals. And what I appreciate about my conversations with Mayor Tibbals is that he's able to bring the perspective, the lived experience, if you would, of what individuals, business owners, local elected officials, how they're processing and how they're trying to plug the gap locally. And so Mayor Tibbals, I'm asking if you can just sort of speak to experiences that you know firsthand or that you've heard from your constituents of how we should be thinking about our safety net and Medicaid expansion.
Well, the Medicaid expansion, as we talked before, we can get into more of that into question and answers if we can just go through this. This is more of a boots on the ground talking, the discussion. And I think it totally supports what Dr. Cahill said earlier on the effects of wealth and health. And before I get started, I'll go ahead and get into, I don't have any fancy diagrams or slides to go through, so you just got to look at this mug for a little bit, or you can turn away and just listen. But anyway, Scott County is a population of 22,000. I've been mayor here for, like she said earlier, from 2010 to 14, which I'll get into details of that, and 2018 to present. Governor Lee and the ARC determined that there were initially, when Governor Lee came into office, there were 15 distressed counties in the state of Tennessee. Now there 3 or 4 have come off and now are considered at risk, but we are still left as one of the 11 or 12 remaining distressed counties. And what that means is the distressed county, it means that more than 25% of our population lives in poverty. And it also means that our median household income is around 31,000. I think they're wanting that to be closer to 35 to get us out of the distressed list. And lastly was high unemployment, which before the pandemic hit, we had gotten down to about 3.4%. So I don't know if that would be considered one of the factors for us. I could go in long and deep about high unemployment because I just think we have a lot of people that was mentioned earlier about people coming off the labor force when they get closer to 50. So we only have literally about 58% of the population from 21 to 65 that are actually part of the labor force. So I really think our unemployment is much worse than it is. The results of such high in poverty and is bad health, obviously. Tobacco use in Scott County is probably double the state average, and that's in the form of not only cigarette smoking, but as well as dip and chewing tobacco and such. And also obesity rates. Obesity rates in Scott County, I guarantee, when I looked into it before, but it's been quite a few years ago, Scott County was way up the ladder as far as obesity rates across the state. And if you look at that, it goes hand in hand, I think, when you got, just like Dr. Cahill said, when you have a low income, high poverty area, people have to find whatever means they can to eat, which is by going to the dollar menus at McDonald's. So give me 2 double cheeseburgers and that kind of thing. Obviously, the health habits are just not there. And of course, when you have that, you end up with high cancer rates. One thing, and also this is bringing out since the pandemic, is that our mortality rate is right at 1.4% for those that infected with COVID, which I think the state average is closer to 1.1 or 1.2. So it's impacted in more than just one place. If we get to the hospital, and that's the main reason for the discussion, the reason I've been asked, I think, to discuss this was the hospital was built in 1955 as a 99-bed acute care facility. 1962, I was actually born there, and many, many people from Scott County were born there. It was the place to go. Back in the day, traveling from Oneida to the nearest hospital would have been minimum hour and a half and sometimes 2 hours. Now, through the years and improvement to the infrastructure, hospitals are much closer. You can be at one in 50 minutes, but still it is fairly far. The county initially ran the facility. Of course, I can't get into much detail about how that went, except I understand there was a lot of politics involved, which caused a lot of complications and disagreements amongst the county commission and the medical world itself. A couple of operators, let's see. There were a couple of operators before St. Mary's came in, which is owned by HMA, which we all know, which of course HMA sold out and became Renova, and now Tenova is owned by CMS, I believe, or CMA. Anyway, but at the time, St. Mary's came in. St. Mary's was paying us approximately $1 million a year in annual rent. About the time, right before I came into office in 2008 or 9, St. Mary's was asking the county to reduce that rent to $500,000 a year. And during the time when the county commission heard those things, the county commission argued about what should be happening. Then there was a dispute between St. Mary's and the county commission. This is before I was there. And St. Mary's decided they just weren't going to pay rent if they wanted to, if the county wanted them to continue to operate the hospital. Around that time in 2008 or 9, St. Mary's became a critical access 25-bed hospital. We also started seeing, I was on the hospital board at this time, but we started seeing the profitable sectors of the hospital, like Jerry Syke, being moved to other neighboring St. Mary's facilities. And even the patients that had good insurance were being moved to their other facilities in Knoxville. In 2010, St. Mary's announces that they want to close. So they gave us a year's notice and said, we'll give you a year, we're out of here. So then in the meantime, that caught us pretty much off guard, but not totally blindsided. But St. Mary's ends up getting into a deal with a company, a gentleman out of Mississippi, who they'd actually signed an agreement for him to take over the hospital in 2011 or 10 when it was actually going to happen. And in the meantime, the county commission was totally unaware of this. The county commission and myself, we started researching the individual and the company that they had signed an intent to transfer the lease to. Come to find out he was under major investigation for Medicare fraud. The county rejected, due to that reasoning in itself, the county rejected the company at that time. And shortly after that, the company owner was sentenced to 10 years in prison. But who knows how that turned out. But anyway, the county had to begin its search for a new operator. And we put out an RFP request, RFPs, and we only had 2 returned. And both of those were considered by the county commission. And the first one was chosen. He was given 3 months to come up with his funding, because we were told by many, many people to begin the hospital operations in a takeover situation, you need anywhere from $5 to $7 million up front to be able to get things going. He could not come up with that funding. So then when he missed his deadline, we went back and chose another company called Pioneer Health out of McGee, Mississippi, who owned and operated 7 critical access hospitals, which seems like it fit more of the mold for what we need. Every one of their hospitals were in rural areas. When we got into the negotiations with HMA and St. Mary's, everything was going smoothly. We spent almost $300,000 in legal fees with good attorneys, and so did their attorneys as well, Pioneer attorneys, I mean. And when we got down to the final time to get things transferred over to Pioneer's main concern and the biggest issue they had left was that the provider number would be transferred over to Pioneer Health. Well, that wasn't a problem with St. Mary's at the time, but they would not indemnify Pioneer for their past cost reports, which there were 5 years at the time that turned into 4 years of past cost reports, and the possible exposure was roughly $4.7 million. So that was pretty much a showstopper for Pioneer Health. So Pioneer Health pulls out of it. So now we're back to square one again. So since then at that time, let me go back to the side, scratch the notes here, sorry. We went back and asked HMA and St. Mary's just to give us a little more time, and I asked that they continue the hospital for 3 months, just to give us a little time to put out more requests for proposals, to get ideas in, and another possible operator. HMA came back. We spent probably 9 hours on debate with the attorneys and conversations with their HMA attorneys out of Manhattan. And they said the only way they would continue to operate the hospital for 3 months is if we were the county were to pay them $1.8 million for the 3 months. That may not sound like much to a Williamson County or a Davidson County operation, but that was a huge amount of money for Scott County. So at that time I had to make the call, and I just told them to do what you got to do. So they did. They were dumbfounded. They thought they had us over a barrel and they were going to force us to rake over the 1.8. And instead we shut down the hospital and 210 people went home without a job. At that time, we were running out of options. We still could not find anyone to run the hospital. So we looked into having it go back to the county operations and bring in a management firm. We brought in that firm. They said, well, you'll need $7 million for us to be able to get things up and running and going. So the next pursuit was finding financing. No one across the state of Tennessee would fund us. We couldn't even find, it was either 7 million or nothing. We could try to break it down, but there was no way we could ever get the funding available. So then we went back to Pioneer. And the deal came back from Pioneer that said, we'll do the hospital if you donate it. So give them the hospital. So we actually went through negotiations, got them in a 10-year contract where they had to operate for a minimum of 5 years in certain conditions. I think they ended up going 4. The only thing it cost them was for the medical office building. We had an outstanding note for around $120,000 on it. They paid it, and then the hospital became theirs. And the hospital reopened finally in 2012, late 2012 it might have been, or early 13, somewhere in there. After 4 years of operations, Pioneer announced bankruptcy of the Scott County operations. Once again, the hospital closes. The bankruptcy courts awarded Renova, a Florida diagnostics company, the ability to purchase the hospital, which they did. And I think the number for that was they purchased it from the bankruptcy court for right at $500,000. At that point in time, Renova comes and uses the hospital as collateral and takes out a $15.5 million loan on the building. Renova also immediately, shortly thereafter, purchases the Jellicoe Hospital, which at that time was a Tenova hospital. No, it was not a Tenova hospital. It was the Jamestown Hospital was a Tenova hospital, and the Jellicoe Hospital, I believe, is still being county ran. I'm not sure exactly. But shortly after that, Renova closes the Jamestown Hospital. Jamestown at that time was a distressed county as well. They've been brought off of the distressed county list, and now they are just listed as an at-risk county. So right now, Renova has operations going on in Scott County and in Jellicoe, which is, for those not familiar with geography-wise, Jellicoe is literally by the crow, maybe 30 miles from here, but not that easy to get there on a drive. Presently, I know I saw the people that are on this call and how the administrator of the hospital right now is on this call. And I want to make sure I will do anything to make sure that that hospital continues to run and will not say anything purposely bad about that hospital. It's probably our last effort. There's not much room if it were to close at this point. Say where the licensure was to become totally not just considered inactive, but the license was lost. I don't think the hospital could ever reach the requirements of new codes that are required. The reason we've been told for difficulties throughout the years for the hospital to be able to operate efficiently is the high indigent volume. Scott County, like I mentioned earlier, you have a high percentage of people that do not have medical insurance. They have chronic diseases. So when they get sick, they don't go to the doctor on a regular basis. They get to where they're extremely sick and where they have to go to the doctor, then they go to the ER, and the ER has to rake out serious amounts of dollars to get these people healed because there is an indigent policy that they do maintain. So if they can take care of them, they do attempt to. If not, they send them to another hospital, but that's all free. They don't charge. It's totally indigent care. The hospital, I would have to say that what helped them recently, they did receive some CARES Act funding of about 6 or 8 months ago, which really helped. There was a time they were missing payroll and some of their vendors were not being paid. And the CARES Act funding, they were still, I mean, I spent a couple of nights in the hospital myself and I was treated very well and with good results. But there's also a high Medicare volume and a low private insurance pay. I mean, there's just not that many people. Another problem is the hospital, Renova, has tried extremely hard to go through all the hoops required to become a critical access hospital, and they have just not gotten that approval from CMS at this point. And then Thursday, to make things worse, Thursday evening, like 2 nights ago, I received a phone call from Congressman Fleshman's office that stated the hospital was turned down for CARES Act funding, which from CMS, which is probably, I'm sure it could be Howell's on here, but I would guarantee this is a major setback for them. And I don't know how we're going to recover from this one. I hope there are some kind of plans on how to keep the hospital going. The one thing, if this hospital closes, we've been through this before, we end up burning our wheels off of our ambulance service. Our run numbers go down. People aren't just being taken care of. Luckily, we didn't lose that many lives when we had the hospital shut down, and we just didn't have those big events. But Scott County is known for adventure tourism. Some hospitals call the people that ride ATVs and side-by-sides organ donors. So it is a high-risk activity. And you have to have an ER close by to handle that high volume of people that come in to ride and play in the woods. Also, I was on a call the other day with a legislative update with other mayors across the state, and I understand there's legislation before the state on modifying, or the understanding from some of the other mayors was that it was actually eliminating the CON process, which I don't know how that can be done. And of course, the people that were adamant against it were the people on the total opposite end of the spectrum of rural counties. The county mayor from Williamson County, which is the richest county in the state, was adamant about not letting that happen. So I'm sure money talks in this situation. I hope it doesn't, but we struggle. That's pretty much my summary on what's happened over time, over the last decade and longer, what happens in rural hospital situations. And it's not pretty, but it's the best we can do. And I hope we can find ways and funding to get funding for the hospitals. I know that Renova is a for-profit facility and has to make money. So things have to be, somehow there has to be a revenue source that comes in to make this thing successful. And I'll just stop right there. Thank you.
Thank you, Mayor Tibbals. Quick follow-up question. Do you know right now how many individuals are employed at the hospital? Approximately.
Guessing 75 to 100.
Okay. All right. Fantastic. Thank you.